So I am so happy and thrilled to be able to moderate this session this morning or afternoon, wherever you are calling in from, maybe even this evening. This is the rapid deployment of a last mile data collection tool here at BAO known as Dharma. Dharma is a really innovative and very easy to use mobile data collection tool that can be used to immediately capture data in real time, regardless of connectivity. And that is actually what makes it so exciting, because what we're really going to see here today is how Health Right International has used it within their programs across Uganda, Kenya, and even in the Ukraine. And with me today is Valerie Kearns, my colleague here at BAO, who is our Senior Director of Product Management. Hello, Valerie.
Hello.
I have also PT Lee. She is the Monitoring, Evaluation, Accountability, and Learning Manager, MERL Manager from Health Right International. Hello, PT.
Hello.
Samuel Wasarika was here. We hope to get him back. Samuel is the Monitoring and Evaluation Coordinator at Health Right International in Uganda. We hope Samuel is able to join us again. And Grace Im is joining us. She is the M&E intern at Health Right International. We are also hoping to have Hannah Radionoska join us from the Ukraine Foundation for Public Health. She is the project assistant there. So with that, and without further delay, I'm going to hand it over to Valerie, who's going to kick us off. And we will first see an overview of what Dharma is as a mobile data collection platform. And then we're going to hand it over to the Health Right International team to walk us through how they then apply Dharma to their projects.
Excellent. Thank you, Nicola. And can Nicola or PT, can you give me a thumbs up or verify you can see my screen for me, please?
Yes, everything looks good. And I'm just going to ask the speakers to turn off their video and mutes once Valerie starts speaking. Thank you.
Excellent. Thanks again. Hello and good day. As Nicola introduced, my name is Valerie Kearns, and I am thrilled to be presenting to you about a rapid deployment of data collection tool. Our agenda today will include the introductions that Nicola just did, a brief overview of what is Dharma, how we support organizations transitioning from legacy systems to a modern enterprise data collection system. And then our partners at Health Right International will share their use cases and experience with BAO systems and the Dharma platform. And then, of course, we'll end with any questions and answers. With me today, supporting the questions and answers is Joy Kim, who is one of our senior implementation data analysts with BAO systems, specifically on the Dharma platform. All right. And as Nicola mentioned, I am a senior director of product management. Specifically, I focus on our Dharma platform product. However, I work very closely with our other product teams, supporting really our end-to-end BAO systems enterprise solutions. And that's really what I want to share with you is how Dharma, how BAO systems, and how our end-to-end solution really fits in the current space. Here at BAO Systems, we understand that our clients need to have a clear understanding of what is happening in the field with their programs. Oftentimes, we hear from our clients that it just takes so long, months or even longer, to be able to gather and analyze the data, to share the data then to the funding partners and to make decisions on how to move forward while continuing to make meaningful impacts and progressing towards the SDGs. The way that our clients often explain this to us is that because they're putting together so many different systems and they have to incorporate such a wide variety of applications, the data represented here by this one singular dot that they collect in the field about their individuals, about the communities, about the people that they're impacting, as it moves through their system, as they integrate it with all of their other applications, that data point starts to become more opaque or conflated with other information. And as it gets finally up to the organizations to do the impact management, up to the platforms like DHIS2, to get information back to the donors or back to the funding sources, it takes a lot longer to be able to truly see what is that pure piece of data and how are our programs and how are our measures and our projects impacting. And we understand that. And so here, at BAO Systems, with our end-to-end enterprise solution for data management, we introduce a unified platform that allows clients to take that historical data, be it paper and pencil, Excel, or even another application, to be able to actually ingest that historical data to create the projects, to create the forms, to be able to, within minutes, be ready to be used within the field, to continue collecting data with minimal impact or disruption to any kind of research project or funding vehicle. We're able to maintain privacy and visibility rules through our user roles, and we offer visualizations within our app or extended analysis through our analytics platform, taking the time to collect and analyze data from months or even years to minutes or weeks. Ultimately, we're shortening the time to delivery of services for you all and being able to impact your communities. So what I'd like to do is actually demonstrate for a few minutes how this is all possible. To demonstrate this, I'm going to be using a data set that's from the National Children's Survey, or NCS, here from the United States. It was a longitudinal study of child health and development at 40 locations across the United States. The study ended in 2014. However, the data is publicly available, as are the data dictionaries. For this demonstration, imagine that I'm a principal investigator or a program manager, and I've been able to secure some additional funding, perhaps, to continue following participants at my site. Perhaps it's to do follow-up with the population around COVID-19 vaccinations, or perhaps it's a follow-up after school to see how this school year has gone and to see how the children at my site were supported. Key to my success is a seamless transition of the research participants to my new data collection system and ensuring that the data collectors are ready to go with minimal disruptions to study operations. The data set that you see here, as I mentioned, came from the raw data that's available, as well as a data dictionary. Within a short period of time, just a few hours, we were able to translate the coded responses into meaningful responses. This data set has just over 5,000 children, and it's ready to be ingested into Dharma. This is the Dharma interface. As you can see, I've already created the programs that I want to follow up with my children and the participants. I just don't have the children ready or available for me to do that follow-up. I'm going to pick my location, and then I'm going to select my file. As the application reads the file, it predicts the question titles and the type of response that is needed. I can scan through. If I have multiple choice options that I need to combine, I can converge options together. And then once I click submit, the platform is now taking the 5,000 rows of data, creating the project, creating the form. You can see immediately the form has been created with all of the fields, and the data is starting to come in. There are a couple of key things that I'm going to do while the application is thinking. First, in order for me to be able to follow up with the children in my study, I need to make sure I've identified a key from this enrollment so that I can connect the follow-up questions, be it about vaccinations, or about school experience this past year to that student. This is how we've structured our case management framework to allow that the individual or the person continues to stay at the middle of our data collection experience, truly giving us a holistic view of what's happening with that person. I'm going to use the child PIDX as the primary key. As soon as I click Save and Push to Mobile, it's available on the mobile device to begin field collection. But first, I need to make sure that I have users available to do that collection. By default, I was created as an administrator since I created the project. And so I'm going to go in and I'm also going to allow myself to be a collector. This is where I can also specify the sites, the groups, or the teams if I need to create a more, a different hierarchy, or if I have multiple locations where I'm collecting the data. In our example, we're just at one site, so I'll leave it at this site. I could also go in and create individual collectors to be able to add data to this data set. And I go ahead and check in on our data, see how it's going. Okay, we've got 5,369 responses, which is the data set. And you can also see that the record here, now I have the ID that we've identified as the primary key for that record. I can also go in and view the details of this individual if I needed to. And I can also go into the results and I can, probably still thinking, give it a second, there we go. I can add some filters. Perhaps I want to be able to see just based on gender or sex information. I can add filters within the application that allows me to see just information about females as I go through and then look at race. I can also modify this visualization if I prefer to see pie charts over bar. Okay, let's go ahead and go into the mobile app though. And before I do, I want to make sure I've connected. I need to make sure that this form in this project is an enrollment form. And so I'm going to use this as an enrollment project. Make sure there's nothing else to update, nothing left to update. The data is there. Looks better. And now I need to connect the projects that I had previously created to that enrollment project. 1 second. It's just thinking since I just did that. And we see this project listed, and I'm able to reference that project now. One other thing I'd like to share, because as I go into the mobile application, this is where you'll see some of our privacy. In this project, I have 2 different collectors. I have collector 2 and collector 3. However, in this project for vaccination, I only have 1 collector. I only have collector 2. What this means is that when I log in as collector 3, I will only be able to see the projects I've been added to, which in this case will be the child study participants and the child school experience. Going to one second, I'm just logging in on my mobile device. Can you all still see my mobile device? I hope that's yes.
Looks good.
Awesome. Thanks, Nicola. One second. I just need to double check my password. I did forget something. Okay, so I've logged in at the top. You can see my username as the collector3. And again, you see the 2 records. One thing that I'd like to point out is you can see for the child study participants, even though I just showed you there were over 5,000 records, I don't see any because I don't have permission to see all 5,000. When I go in, I can create a new record. I'm not going to add all the questions just for time's sake. I can select the recruiter type. I can do the date of birth. Okay. And so again, I'm just going to save this for now to share. This cloud means that it's waiting to be uploaded. If I'm collecting data offline, all the records I create will stay in an offline manner until I get back to connectivity. When I go in to create a new record about the school experience, first, I select who I'm following up with. You can see, even though I couldn't view all of the enrollment records, I have the ability to create a follow-up with any of the 5,605 records now that I've created a new one to select. I'm able to search up here as long as I know the participant ID, and I can select which participant I'm following up with. This ensures that we protect any PII and its de-identified data. I'm also able to capture consent right here. And then I can, of course, capture the name or the participant ID. And now I'm able to ask questions. What you'll see here is that when I ask questions, I have additional logic that then displays for me to be able to answer further questions. If I say no, I have a follow-up question based on the logic if I had access. These records, as soon as that they're created and then synced, I can then follow up and see them right within the application. So if we go to our study participants and we go to our data, there's now one more. And if I go to the very last page, I can see that record that I just created. If I have permission from the web app, I can then go in and modify that record and add data to it to be able to complete the record or do any follow-up. I also, as a program administrator, am able to go in and see the data that was just created here as well. And I can, again, start to look at any real-time immediate results to help inform information. I'm able to export the results in one of 3 formats. I can either export the data as Excel, coded CSVs, or named CSVs, and I can integrate from Dharma directly to our BAO analytics platform to add additional layers of analysis to enrich the collection experience that we have from the platform. I hope that this shows all of you how within less than 30 minutes, we've been able to ingest over 5,000 records. We are able to deploy into the field for all of our collectors to continue to collect data, to then see the data come back in and to be able to continue to integrate it to other platforms within the BAO systems, enterprise solutions, or even external systems that you may already have set up. With that, I'd like to go ahead and hand it over to PT. Thank you all for your time, and I look forward to answering questions at the conclusion of this presentation.
Thank you so much for having us here. Welcome, everybody. My name is Untitled. I go by PT. I am the manager for monitoring, evaluation, accountability, research, and learning at HealthRight International. We at HealthRight believe that health is a human right, and we work to empower marginalized communities to live healthy lives all over the world, especially in low and middle income countries. We use an asset-based approach where we center on and draw on the strength of the community members to generate the solutions to build their resilience and work to narrow the health equity gap among marginalized communities. These are some of the marginalized communities that we work with, including vulnerable women and children, people living with or elevated risk for HIV, refugees, asylum seekers, IDPs, survivors trafficking, survivors of gender-based and intimate partner violence, and LGBTQ communities. This is a map of where we have and currently work in the world. Over the past 30 years, we've worked in many countries. We currently have active projects in 5 countries, and you hear about 3 of those countries today. Let me give you some context in terms of our Dharma/BAO systems journey. We wanted to go into, enter a process of strengthening our current M&E systems and developing an organizational-wide system for data management. We wanted to accurately and timely have collected data on the project, the program, outputs, outcomes, impact for the organization, for our donors, stakeholders, and our board, build an evidence base around our interventions, tell us if and when we're meeting our program and org objectives, and then generate some of the brief reports and analysis for internal purposes, so for quality improvement, as well as for external purposes, dissemination of findings to donors, to academic conferences, etc. And we realized that in order to do that, we needed to have a systematized and standardized data collection system. Thus began our Dharma and BAO systems journey, which started in the spring of 2019, where we created the purpose and engaged in the initial steps, which included working with Dharma to build a test case so that we can explore a lot of the functionalities that Val talked about, as well as other functionalities and capabilities within the Dharma collection platform. And then in 2020, we implemented 3 pilot projects in 3 countries that we're going to be talking about today. And the purpose of this was to make sure that our local M&E staff understand the full capabilities of Dharma and are able to develop the project themselves, working with our Dharma liaison, Joy, throughout the process of understanding what the workflow is, developing the project within Dharma, training the people, the M&E staff, the local staff on the ground to collect the data. So I will introduce one of the projects, and then I'll hand it over to Grace, our M&E intern. I'm presenting this on behalf of a colleague in Kenya who was in charge of the project, developing the project, pilot testing it, but cannot be with us to present at the summit. This is a SACO project in Kenya. It is using the SACOs, the Savings, Credit, and Cooperative Organizations, to reach boda drivers. These are basically motorbike drivers in Kenya to conduct community-based HIV testing. In Kenya, HIV/AIDS is the leading cause of death, and transportation workers, because of their working hours and their mobility, are a hard-to-reach population. So we use SACOs as a point of entry to conduct this community-based HIV testing. And as part of the SACO project, we conducted mobile health outreach clinics at the SACO affiliated community-based venues, so that we can reach and then conduct the HIV test, referring to treatment, etc. Part of that is basically collecting forms at these outreach events, data from the forms at these outreach events, such as the number of HIV tests that were conducted, the referrals, when the event was happening, etc. So in terms of the data collection is pretty straightforward. So what we needed really was to put a form that we had created onto the digital platform or on Dharma. And we determined that a single point system or data structure would be best for this project. Now I'll hand over to Grace to go through. I can continue with the slides, Grace.
Okay. Hi, good morning, everyone. Very nice to be here with you today. As PT mentioned, I'll be speaking on behalf of Jackie for the Kinesiako project. So our process with the Dharma Biosystems began early July of last year when we first overviewed our current workflow with Joy. And our setup at the time consisted of just pen and paper data collection, which we would manually input into an Excel master sheet, which was then used for analysis in our donor reports. So we started off by mapping out a timeline with Joy to transfer the workflow to the Dharma Biosystems, setting up the forms online based on our current paper forms, and learning how to just utilize the different features of the Dharma Biosystems to collect and analyze the data that we needed. So, and then throughout the next couple of months, we worked on this pilot project, communicating with Joy and receiving feedback on how we could best optimize the system for our fieldwork. And once we completed that pilot process, we began to input both our old data, which we had on file, as well as our new incoming data up until this year. And we actually recently completed the data collection process and are currently in the analysis phase. So some lessons that we learned throughout this process were basic troubleshooting and details that we missed, such as just being mindful of the questions and the calculated response feature, which automatically calculated a numerical output, but it would not work if the questions it was trying to calculate did not have a response input. So little things like that where we would have to mark those questions as required. And at some point when we were cross-checking the latest records with Joy, it seemed as though our team was missing some data, but it turned out that there are different ways to save on the mobile record. So it was just a good reminder for us to always sync the data at our main site before exporting it so that all of our records collected on the mobile and tablets would. But in general, the Dharma Biosystems wireless data collection feature was a crucial part of our surveying and data collection process because stable Wi-Fi is not always guaranteed at our field sites. And overall, as we tested the system out and became familiar, we just learned how to navigate these sort of technicalities and able to optimize its features under the guidance of Joy to best collect the data that we needed on the hard-to-reach transportation workers in Kenya. Yeah, so thank you so much. And I will now be passing it on to our next speaker, Sam, who will share about their project in Uganda.
Great. Thank you so much, Grace. Samuel, if you are there, you are on mute. Are you able to hear us?
Thank you, Grace. Hope I can hear you well.
Great. Coming through
you
loud.
Can hear me well?
Yes.
Okay, thank you. I'll basically be talking about our Ugandan project that we are using for this application, Dharma. We have very many projects, but we have so far piloted Dharma using one project where they are typically using Dharma for all the data entries. So we are using it for a project called Integrated Physical and Psychological Rehabilitation Assistance for Victims in Northern Uganda. So this is a project which basically has two components. It has the mental health aspect as well as the physical rehabilitation aspect. What we do screen our beneficiaries using Dharma, that is for the psychological part of it. And those ones who qualify for physical rehabilitation are qualified, but after being screened for the mental health aspect part of it. And we have a number of tools that have been uploaded onto the system, and they can earmark for us who qualifies for which intervention. Basically, they are community health extension workers, as we call them here locally. or village health teams. These are the first line people who use these tablets for screening with the application Dharma. But also our staff, Health Right International staff, also use the application while screening the patients. The screening takes place at the community level and also at a hospital level, where our staffs do meet some of these beneficiaries. You can go to the next slide. Thank you. So the process is there's basically initial screening. This is where we get the demographics, and also we do the psychological screening of the beneficiaries. For the first time we are meeting them. Then as they're screening these people, we keep seeing results. For example, if you've scored so high on a certain tool, you may qualify for a specific intervention, and you're managed according to the scores. We have some people who score so highly and are even referred to other government facilities for further management. Then we have those people who are met individually. Then we have some people who are met during group counseling based on the scores that they have got. So based on the scores also you have got, there's a periodic follow-up for most of these beneficiaries. It takes place between 1 week, 2 weeks, and even up to 6 months follow-up. So when you come back for follow-up, we do rescreening while we are using the same tools for us to measure the improvement of the patient. This is why Dharma has been so helpful to us. We are able to see how someone is progressing according to the care they have received. Then, of course, after seeing someone and we have followed up someone, we need to tell a story to the funder. So each month we do monthly reports. These ones are mainly internal, the organization, but they help us to help the program people to make decisions and also to see the weaknesses which they can make strength in. At the end of the quarter, we do share our quarter reports with the funder. Actually, on 15th of April, we did share our first report where I used Dharma to analyze the data to our funder. Here we do analyze the downloaded data in form of CSV because we're interested in analyzing certain tools. For example, how people are trending on the different tools and based on the different interventions. We did analyze this for the funder. We just submitted our report on the 15th of April, this same month. So for the lessons learned, we envisage a cloud storage of data even after editing the forms. We right now whereby if you edit the form, you're bound to lose out some data, but it has been submitted to BAO, and we hope it can be worked on soon because the tool won't be typical the way it is. It can keep on changing as advised by the our program managers. Also, we would love to download data. For example, people who came at a certain level for the first follow-up would love it to come out as individual data, not to have data downloaded at once. For example, seeing all people who have come at different levels of follow-up being downloaded under the same CSV formats. And we're also in discussions with the designers of Dharma. Yeah, so that's how basically Dharma has worked for us, and we work closely with Joy from BAO to design all these tools. Mental health has quite a number of tools. There are so many. I think we have like almost 12 tools which are uploaded within this tool, but we have managed to organize it for our field staff to use it in a friendly way. Thank you very much.
Thank you so much, Samuel. And I think our last speaker is Hannah from Ukraine. Hannah, we are ready to hand it over to you.
also want to continue on Hannah's note. What Health Right is doing in terms of our plan beyond for 2021 and beyond. We're going to continue with the data collection and some of the analysis for the existing projects that you just heard about. We're also in the process of onboarding new projects into Dharma. We have two new projects that will be coming on to the platform from Kenya. And then we are also working very closely with Joy to develop an organizational-wide kind of process and project to collect indicators to at the organizational level, so across our projects, across our countries, etc. So that's all, Nicola.
Great, thank you. And so sorry for jumping into the conclusion so quickly. We do have several questions that I really want to run through before we wrap up. We are running a little bit behind time, so we're going to try and do these in rapid fire. And so the first question that I think might be the easiest to answer is, can Dharma ingest more than 5,000 records? And I think that's very simple yes. Val, do you want to expand on that?
Yes, so the answer is yes. We have ingested up to 4 million records. Obviously, when you start getting into those millions of records, we do it in a slightly different way than what I demonstrated today, but yes.
Okay, again, all right, here's a really great question. And I think this is in reference to a little bit of the Uganda experience. Uganda was actually famously known for pilotitis at one stage, where there was a very famous map of Uganda and dozens of different data collection tools being used there. So I think more broadly, given the vast landscape of the different data collection tools that are out there, how did Health Right land on Dharma, and what was it really the deciding factor that you guys what was the deciding factor for you guys to choose it?
Yeah, really good question. I'll just highlight three that we considered. First of all, I think Dharma is very user friendly. So as Val, demonstrated, it's a very user friendly platform. We liked it. Dharma also has a very tailored approach, as all of our country staff alluded to. We worked very closely with Joy, our Dharma liaison, to develop the project, to troubleshoot the issues. So we really liked that tailored approach as well. And then the ability to export data into more advanced analytics platforms such as Tableau was one of the primary reasons where we started with the end in mind in exporting data to Tableau, and then Tableau informed us of the Dharma collection platform. So we then went to Dharma and exported.
Great. Okay, two more questions. So Val, one of the things that it really struck me as we were going through these three different examples was that the ability to change the survey over time may be very important to the end user, either by adding additional questions, taking questions away. Can you talk a little bit about the flexibility to be able to change the data structure and survey over time? I mean, particularly given in this kind of like global pandemic post world where, things are clearly changing very rapidly. It impacts our programs, and therefore we need different information over time.
Absolutely. And I think Samuel spoke to this a little bit as well. So there are certain modifications that we support today, regardless. But we also, to your point, Nicola, know and understand that part of being able to be a data-driven organization and making data-driven decisions means that as you get data, you need to change and evolve. And so to that end, part of our roadmap and part of what we're looking at enhancing is retaining that easy-to-use interface to create the forms, to create the projects, while simultaneously also being able to really support form versioning and creating a sense of the timeline and the version of the form that the data was created, so that we can make sure when, as Grace mentioned, being able to pull out the data into other tools and into other analytics and analysis, that we don't lose some of that because of a modification or because a question went from these options to this option, and making sure we can reconcile that. So yes, we do support certain modifications. Samuel, PT, and this entire team have been great in providing us additional insights and feedback on where they'd like to sort of push that limit and how to get to the next phase. And as a product team, we absolutely work with our customers and our clients and our partners to understand the best user experience to facilitate that.
Excellent. Okay, last question. Can you talk a little bit about how Dharma keeps personal identifiable information secure?
Sure. There's a couple of different layers to this. So from a very technical perspective, everything's encrypted at rest and in transit. And if you need more technical stuff, please feel free to contact me after this. From a user perspective, as you saw through the demo, when I added different people to different places, even if they couldn't see the record, we're able to expose key information for them to follow up. So if we think about Hannah's example, where HealthRight is supporting vulnerable individuals, especially in a mental health facility, you might have the actual intake nurse probably doesn't need to know all the information that is happening in a conversation with a mental health professional. And so we are able to assign the intake nurse to specific roles, specific projects, to be able to see what they need to see to create the enrollment. But then we can have the mental health professionals and practitioners added in other roles and in other projects to be able to see everything or what they need to. Additionally, we are GDPR compliant. So for those customers, those clients, those partners who are concerned about anything around GDPR and the right to be forgotten, we fully support that. And we are able to also remove data from the database as well. Hopefully that answered to the level that was needed for today.
Absolutely. And so with that, I want to really thank everyone for here today on the panel from HealthRight International, Hannah, Grace, PT, and Samuel and Val. Thank you so much for sharing this.